Thank you. Thank you for that very, very kind introduction. It really is a pleasure to start the day here with all of you. The work that our community health workers do is so important to the communities that we serve, but it's really essential to the mission of the Ohio Department of Health. And why is that? Well, it's for a whole variety of reasons. Probably first and foremost, the reality that you are trusted members of your community. You come to the table with a different kind of relationship with the people that we're reaching out to, the people that we're serving, than so many of the other members of the outreach team that we have. And you're bringing a broad range of lived experience into that engagement that you're having with the people that you're serving. I was having a conversation while we were waiting for everyone to gather. One of the things that we were talking about is how important it is that your work engages people very often in their homes. That's really essential very often to first understanding how that individual is really encountering and experiencing their healthcare. But it's also very often a really important component of building trust with them. And we know that trust is such an important element. Really what you're doing is helping us connect with the people that we serve. And that connection is just so important. You're providing education. We know that your work really is, in so many ways, the work of being an educator. And of course, you're helping people to understand and identify what health services, especially preventive health services, can make a real difference in their lives. And for so many of the communities across the state of Ohio, it is those preventive health services that really are among our most important challenges in terms of reaching them with healthcare that makes a difference. Because, when a person is in crisis, most people know, well, you know what? Things are bad right now. I better get to the emergency room. But when it comes to avoiding the problems that are going to lead to that kind of crisis, it's understanding the preventive health interventions for whoever they are at whatever stage of life, whether they're a mom-to-be or they are one of our seniors. And your work is just so important in achieving that. And your work also, though, in that vein, links very directly to the key programs for the Ohio Department of Health in terms of our mission and what we're trying to deliver. First and foremost, the beginning of life. And all of our work that is such a high priority to the governor around reducing infant mortality and specifically addressing some of the inequities that we see in the healthcare outcomes in our infant mortality, particularly in our Black community. Our breast and cervical cancer project, another very, very important one, where your work is helping to enroll more and more women. And when we think about preventive health services that have the opportunity to make a real difference, that's a big one. And your work is vital there. And while there are many others, the last I'll mention is our Coverdale Stroke Program, which of course is very important, primarily for our older Ohioans who need to understand not only, look, what are some of the early signs and symptoms of stroke? Because you know what, stroke is not what it is today. It's not what it was when I was training. Stroke is like a heart attack, a condition we can intervene on. we have the opportunity to take someone who's having those very early signs and symptoms and deal with it before we have permanent damage. But we also have the opportunity to help them understand the lifestyle risk factors, the preventive health that can maybe keep them from ending up in that situation. Your work so vital to that. And then, of course, as they were mentioning in that very kind bio that was shared, COVID-19 has kind of dominated our work over the course of the past 2, 3, 4 years. And your work around COVID-19 has been essential for the outreach efforts of the Department of Health. For one, because you helped us have the kind of connections with the local health departments that are so important for the work that we do. You know, the Ohio Department of Health works through community organizations, especially the local departments of health. And you served as vital bridges in COVID-19 to that work. How? Well, through information and getting information out to the community, especially information about testing and the availability of testing resources, about vaccination and how to get vaccines, and important information about vaccines, particularly when understandably, am I not? Okay, sorry about that.
You can shout it from the rooftops.
Okay.
We love hearing how cool CHWs are.
Particularly when it came to issues that had to do with people's trust in the vaccine. So I think that that's all something that you should feel good about, but there's nothing like seeing the outcome of your work and seeing other people evaluate that work and say it made a clear difference. And we all have a recent study that I think should make you feel very good about the work that you did around COVID-19 that came out in The Lancet. And The Lancet, as you may or may not know, is one of the most prestigious of the medical journals out there. And what it showed was that Ohio really led the nation in achieving low mortality, that is a low death rate from COVID-19 when we adjust that rate on the basis of underlying risk factors, things you can't really deal with, realities that people have as they're developing COVID-19, right? So that's an important adjustment to make. And when they looked at that, Ohio was 8th in the nation. That's very impressive. And I'll tell you, I know that a piece of that, and a very important piece, was your work around education, around awareness, and around building trust. So thank you for that. Your work on so many fronts is just so very important. And so with that in mind, and recognizing just how important your work is, I have something that I think is wonderful to share with you, and that is a proclamation that Governor DeWine has issued and has signed, and I'm going to take a moment and read it to you, and then I will leave that with your leadership for your organization. But let me read this proclamation from the governor. Whereas community health workers are frontline public health workers who are trusted members of the community they serve. Whereas community health workers represent trusting relationships which enable them to serve as a link between health and social services and the community to facilitate access to services and improve service delivery. Whereas community health workers are well positioned to help improve health outcomes and address health equity for low income, underrepresented, and minority communities. And whereas community health workers also assist mothers in Ohio to ensure healthy pregnancies, births, and follow-up medical care. And whereas community health workers share resources and education about disease prevention and treatment, as well as management for those they serve. And whereas community health workers help remove obstacles to health and wellness for their community members, which helps ensure that Ohio remains a center for healthcare innovation. Now, therefore, we, Mike DeWine and John Husted, Governor and Lieutenant Governor of the state of Ohio, do hereby recognize Community Health Worker Day on this 6th day of June, 2023. So, congratulations to all of you. I think a very suitable recognition of your incredible work. And as I close, I just want to reiterate that you are essential members of the public health care team and really vital members of the Department of Health's outreach into every community in our state. And I am very, very grateful for the work that you do. So thank you and congratulations on your recognition.